Good afternoon. My name is Beatrice Shodiende Igenti, Center for Disease and Control Prevention, which is known as the CDC, and the Food and Drug Administration, which is known as the FDA, are two federal agencies concerned with protecting the health of the people in the United States. They do that via national campaigns, and they both disseminate health information and are supposed to act as credible and accurate information sources. Agencies' efficacy are measured by the responsiveness of individuals and compliance with government messages and regulations. It also possibly depends on the degree to which these agencies are viewed as trustworthy, knowledgeable, and credible. The study conducted from August 28th through September 3rd, 2020, offers a striking insight into how the chaotic response of the U.S. government to the coronavirus pandemic by both the Republicans and Democrats is sowing mistrust. It also exposes increasing partisan divisions regarding credible health information sources. Public confidence in the CDC has dropped by 16 points since April. According to the new poll, the agency has been widely criticized by both public health officials and advocates who want the agency to be more frequently and to stand up to political pressure, and by Trump, who has accused it of being overly cautious and thwarting the U.S. recovery from the ongoing pandemic. Thank you.
Okay, so the history of the CDC, it originated in 1964 and opened a small floor in the building of Atlanta. So when they first started, their original goal was to prevent the spread of malaria across the nation. And then as time progressed, the CDC founder, Dr. Joseph M., advocated for not only the spread of mosquito viruses, but also other diseases. However, in the early days, we did not have this knowledge on diseases like we do today. But because of the CDC, disease surveillance became one of the milestones of the organization. So just a quick overview of the CDC. So in the 1990s, they created the first national health objectives. In 1978, the first drug resistant to tuberculosis outbreak happened. In 1975, they established sanitation programs in cooperation with cruise ship industry. And then in 1975, the Chronic Disease Division was established, and it targeted cancer, birth defects, and environmental issues.
Today, I'll be talking to you all about the pros and the cons of the Center of Disease and Control Prevention, best known as the CDC. The CDC protects America from health, safety, and security threats, both foreign and in the U.S. Whether diseases start at home or abroad, chronic or acute, curable or preventable, the CDC fights diseases and supports communities and citizens to do the same. A pro about the CDC is that they put science into action. They track diseases and find out ways that make people sick and the most effective ways to prevent them. A con about the CDC is that when they deliver the information to the public, it sometimes can be confusing and misleading.
There have been a few different CDC controversies through the years. In 1998, a major controversy occurred over the prevention and control of antimicrobial drug resistance. The education efforts on antimicrobial drug use in hospitals had mixed successes. More aggressive and controversial approaches to improve the use of these drugs have been proposed by the CDC. For example, excluding certain drugs from the routine reporting of the susceptibility results, or antimicrobial use audits targeting problem areas. For example, no diagnostic testing had been done, or more than 4 drugs had been used during one hospitalization, or used for more than 3 weeks continuously. Much more recently, the COVID-19 controversy. The CDC had originally said that people should only get tested with COVID if they felt symptomatic, and they didn't need to be tested if they didn't feel sick. Many health experts sent in a lot of criticism, wondering why the top public health agency would say such a thing amidst the pandemic. The CDC later said anyone who has been within 6 feet of any infected person for at least 15 minutes should get a test. The CDC has since taken out that people didn't need to get tested if they didn't feel sick as a clarification due to asymptomatic and pre-symptomatic transmission of COVID.
How the COVID-19 pandemic has affected the trust in the CDC and how the CDC has become a political tool/strategy. The CDC is familiar with MMWR, which has been around for nearly a century. It is loaded with reliable and timely data that is analyzed by the world's top scientists, which is required to read during a pandemic. Okay, so if public health officials lose confidence in this vital tool and doubt the substance of this report, the U.S. response to the coronavirus would have been dealt with yet another setback that stands and plays out great suffering and more deaths in communities across the United States. So basically, they use politics and all that to let them know how they want them to present the information, and everything ties up to how the media says things.
Hi, I'm Christopher Valdez, and today we'll be closing our presentation by talking about what are some of the common errors that the CDC has made that led the public to lose its trust in the public health organization. The CDC has gained a low level of public trust, especially through the past year since the beginning of the coronavirus pandemic, specifically losing the trust of the Republican Party, who has a great influence over the American citizens who identify with that party. Local and state officials seem to be upset with the CDC, claiming that it has lost its core value of keeping the country healthy. Errors like going against public health officials to say children should go back to school, despite the ongoing pandemic, seems to be way out of character for the public health organization. And mistakes like the publication of information regarding diseases and viruses has been taken down by the org in a matter of minutes after it's been publicized, causing the level of trust to lower between the public who reads it, news outlets who publish it, or even the local and state level officials who use it as a guide to help implement guidelines and regulations to prevent pandemics. I want to thank everyone for watching the presentation. I hope you enjoyed it. Have a great rest of your day.